a OR nurse, then your journey will stop here. So our ICU nurses, our med surg nurses, our pediatric nurses, our job stops right here, right? We've called the pre-op area. So let me explain that, because I talked about that and I'm not sure if you guys know. So your patient will be placed on a schedule, right? So it will give you a time that the patient is going to get surgery, and they may or may not come during that time. But anyway, the PACU nurse, not the PACU nurse, the pre-op nurse is going to call you and say, hey, I'm ready for Mr. Jones. Can I have a report on them? So report on him, we're going to give our SBAR reporting, which we talked about in fundamentals, right? And we're going to let them know about the patient. Hey, they have a working IV, and I've completed all the pre-op checklists. All right. So then we hand that patient over. We take them to the OR, and the pre-op phase is over. So they're on that intra-op OR bed, and this is now the OR job. This is the OR's nurse. So this is doing the surgery, right? So this is their job, and I really can't say much about what they're doing there other than perform the surgery and making sure that sterile and surgical asepsis is followed, because we're opening our patients up on a table. We do not want to be putting them at risk for infection by breaking sterile procedures. So your sterile procedures would definitely come in handy right here. Different type of positioning for patients doing surgery, and all these things happen in the intra-op phase. So in our surgical environment, we have unrestricted zones, street clothes are allowed, right? Semi-restricted zones, strubs and caps. But in our restricted zone, strub clothes, shoe covering, caps, masks, all that stuff that you can see that these people are in this picture, that is the restricted zone. So even if a nurse is in the OR, she could be in the semi-restricted zone. So it's important for you as the nurse to know your role. So the anesthesiologist plays a big role in surgery because there are different types of surgery anesthesias we can get. We can get minimal sedation, and typically the patient can respond to verbal commands, and the cognitive function and coordination may be impaired, though moderate sedation. You then have deep sedation, right? So you want to know the difference between your sedations, right? Because we're in our deep sedation, the patient cannot be awakened easily. And normally once you get into deep sedation, that's when your patient is going to be intubated, because now that anesthesia has paralyzed the respiratory muscles. But with moderate sedation, the patient can maintain an airway, so they won't need to be intubated there. So while they're in the OR, patient safety is still priority. Patients can have allergic reaction, drugs toxicity, or reactions can happen. You know, they can even have cardiac dysrhythmias. Different things can happen during surgery that can make it very, very difficult. So the patient can be overly sedated, right, where we can't really wake them up because anesthesia then gave them too much. So under sedated, meaning that patient can hear, that patient can feel some of the things that's going on during surgery. Trauma can happen, right? Burns and all that stuff. That blood pressure can drop. Thrombus. Guess what? This is your Grey's Anatomy slide right here. When all those things go wrong during surgery, definitely is Grey's Anatomy. So if you want to think about it like that, things that can go wrong in surgery, because surgery is not just an imperfect environment. Things can go wrong during surgery. So back to some more things that we need to keep in mind is anesthesia awareness. Okay, if they're getting general anesthesia, they're going to need to be intubated, and if they're intubated, you know, this patient can't breathe on their own, we're breathing for them. Knowing that stuff, knowing about nausea and vomiting that could happen if that patient eats before surgery. So knowing things that could protect our patient. Anaphylaxis, knowing that they could have an anaphylaxis reaction in the OR, hypoxia, any type of respiratory complications, hypothermia, and malignant hypothermia, hyperthermia could happen, and they could be at risk for an infection. So knowing all these factors factors of surgery can help us